I graduated in medicine in 1971. I practiced as a general practitioner for a number of years. And about 20 years ago, I developed a bit of chest pain and saw the specialists and went through the rigmarole of the angiogram and preparation for bypass surgery when I happened to encounter a patient who was active in the Chelation Association. So I looked into that and underwent that treatment. And to make a long story short, it solved my problem. I had no bypass surgery. It's nearly 20 years now. But this was my introduction to alternative medicine, and I've learned quite a bit about nutrition, particularly the role of sugar in our present society, and that's what we're going to talk about today. 100 years ago, it's said that the average North American consumed 20 pounds of sugar per year. Now it's close to 200. You have to go back to the Egyptians, perhaps, back to the societies that began to mill grain and to make flour. It's 5,000 years, which seems like a long time, but it really isn't a very long time in the history of mankind. And this, it would seem, is where the problem began. Barry Sears, who writes books on nutrition that you see in the bookstores, usually the word zone is in the title, living in the zone, this sort of thing. He claims that the Egyptians, as proven by the x-rays of mummies, became shorter and fatter in the few hundred years after the milling of grain. There's a huge problem with sugar consumption, and it doesn't seem to be very well recognized by the medical profession. I think the nutritionists just consider sugar to be an extra source of calories. And in fact, sugar has some rather profound effects and has a lot to do with type 2 diabetes. And yet, the average doctor in the publications that you read and listen to, they discuss weight loss in terms of fat, they suggest more exercise, they talk about genetics, they talk about the distribution of the disease in society, but nobody ever talks about sugar. And I think this is odd when diabetes is all about sugar. In today's society, we have an epidemic of type 2 diabetes, and patients are not being told that if they were to restrict their sugar, or what is called glycemic foods, which include bread, flour products, obvious sources of sugar, soda pop, that sort of thing, beer, if they restrict their sugar, type 2 diabetes can be cured. Unfortunately, this message is not getting across to people, and they're having to end up on pills in order to keep their sugar down. I think it's important to differentiate between type 1 and type 2 diabetes for the purpose of this discussion. Type 1 diabetes, or juvenile diabetes, is a medical problem where the pancreas is insufficient and the patient has to take insulin by needle for life. Type 2 diabetes is a totally different breed of cat. In type 2 diabetes, there's nothing wrong with the insulin levels. In fact, they're often very high. The problem is the insulin in type 2 diabetes seems to be unable to control the blood sugar levels, and this is called insulin resistance. Now, insulin resistance is a very complex problem, but it's important to understand that high insulin levels in the blood do quite a lot of damage. High insulin levels cause high blood pressure, it causes blood clots, it predisposes a person to inflammation such as bursitis, tendinitis, and all the itises. In other words, high insulin levels are a wrecking ball. Now, it's important to understand that the only thing that can cause high insulin levels is sugar. The only thing that can lower high insulin levels is restricting sugar. And, by the way, exercise has a little bit to do with that too. However, the medical profession seems only to talk about fat, total calories, and exercise. Even the Mayo Clinic doesn't check serum insulin, and most local doctors don't even think about it. Now, if a patient continues to have high blood sugars, even in a type 2 diabetic situation, they will eventually be put on insulin by needle. Now this is on top of their already normal or high insulin levels, so you can see it's almost like a death sentence. It's going to be very difficult in our society to do anything about the type 2 diabetes epidemic. When you consider we have donut shops, bakeries, candy stores, huge companies making soft drinks, huge companies making dry breakfast cereals, all of which contain nothing but empty calories. Furthermore, people are very reluctant to give up their comfort foods, and the medical profession, I think, gave up long ago trying to get people to change their diets. As well as the obvious sources of sugar that I've mentioned, there's one misconception in our society, and that is that bread is okay, especially whole grain bread. Unfortunately, this is not true. White bread will raise the blood sugar faster than anything else, and that's why it is used as the standard for glycemic foods. Barry Sears, for one, in his Zone books, gives people balanced diets in order to keep the insulin levels low and avoid the high carbohydrate stress. People can go to Google and check on the glycemic index of various foods and should be able to select meals that are tasty and well within the boundaries. In the average North American household, the problem is mainly to cut back drastically on the consumption of bread and obvious sources of sugar. Mashed potatoes, incidentally, are pure starch, whereas a baked potato, if the skin is consumed, is quite healthy. Just for example, a typical breakfast could be fresh fruit and cottage cheese. A lunch could be a salad. Dinner could be steamed vegetables and a piece of fish or a chicken breast. We have to stop giving children soft drinks and bread in their lunches. Just to wind up, the bad news is we all have to give up some of our comfort foods. The good news is that after a period of time, one loses all the craving for the wrong foods, so there is a reward.